Hi, I'm Anna Wouters. I'm an OBGYN with Women's Care Florida, and I'm here to talk about induction of labor. Induction of labor is a process that happens every day. About 1/4 to 1/5 of all women will require an induction of labor, and it's something that is decided between you and your healthcare provider depending on several circumstances: the age of the baby, the state of your cervix, and what other medical conditions you have going on that might mean that you need to get induced. In order to decide how we induce you for labor and who gets induced for labor, we have to first check your cervix. At a cervical check, we check 5 things. We check for the dilation of the cervix. We check for the effacement, or how thin your cervix is. We check the station, which is where it is in the pelvis, the position, and also the consistency. And we use those factors to then decide whether or not you're a good candidate to be induced. In women whose cervix is not ready for labor, trying to induce labor increases the risk of cesarean section by 2-fold. We use several different agents, known as ripening agents, to try and ripen the cervix from an unfavorable state to a favorable state before we start a medicine known as Pitocin, which would then cause contractions. So prior to receiving that, your cervix has to reach that favorable state. In order to get it there, we have several different options. We can use a mechanical dilator known as a Foley bulb. We can use medicines, and there are essentially 2 varieties. They're both prostaglandins. All of these medications work to move the cervix from unfavorable into a more favorable state. So if induction of labor is something you have further questions about, please come in and talk to us. We're happy to take care of you.